There was some concern, which is why we originally opted not to do it. Plus, I am of advanced maternal age. As they say, I'm 39. I am Donna Villavicencio, and this is my daughter Ava, and she's 5 weeks old. Originally, my husband and I decided not to have an amnio, and there was some things that came up on the ultrasound, so we decided to have the amnio.
During that ultrasound, there were some findings on the ultrasound that we were suspicious for a couple of things. I'm Dr. Allan Fisher. I'm the Director of Maternal Fetal Medicine at Morristown Memorial Hospital here in New Jersey. Once they had that information, they decided to have the amniocentesis, and we had an answer actually back in a very short period of time.
She actually did have a variation of normal chromosomes, so we did meet with a genetic counselor.
Our genetic counselor, as well as myself, spent time with Donna and her husband talking about what that all meant. And then as the pregnancy continued, we spent more time with them every time we saw them. And
Dr. Fisher did a lot of follow-up ultrasounds, but she's doing great.
Amniocentesis actually means that you withdraw some of the fluid where the baby's swimming and using a needle and doing that. The needle itself is the same size as if we draw your blood. That's how thin it is. It's just longer because we need to get where we need to go. And then we send it to the lab and they grow cells from that amniotic fluid and they look at the chromosomes from there. The main things that we look for in the amniocentesis is looking at the chromosome number itself. We could also look for whether there's large pieces of the chromosomes that are moved or deleted or duplicated, or whether there's extra chromosomal material. We don't look at really small pieces that are deleted or duplicated, and we don't look at the genes themselves. Now, if we have a suspicion that something is going on, or we have a family history of that and we can test for it, we can do those tests as well. If you look at all children born in the United States, and you say, okay, what's the percentage of them having some type of chromosomal or genetic problem, it's about 3% of all newborns. By the time they're 5 to 7 years of age, that works up to about 7%. So the system itself, the genetic system itself, is about 93% efficient.
I barely even remember it. It was very quick. I don't even really remember what they did, and it didn't hurt very much at all like most people think it did, and it was quick.
The procedure itself actually doesn't take very long. It takes about 10 minutes or so to set up for everything, and once I'm in the sac, it takes about less than 30 seconds. So when Donna says that it didn't really hurt very much, it generally doesn't. I tell people that when I go into the skin, it's just like drawing blood. When I go through the uterus, it feels like menstrual cramps or a flu shot in the arm. In general, the amniocentesis is performed approximately 16 weeks if somebody knows that they want to have it as an elective. But it can be done up to 22 weeks or even sometimes later than that as well. Typically, the wait really isn't as long. Normally, 20 years ago, it was 3 to 4 weeks. Now it's less than 2 weeks. And, but you can, if we're looking for something very specific, get particular chromosomes and get that answer in 24 to 48 hours. Oftentimes, we have to give bad news. And that is part of our training. I usually take a very straight approach to talking to the patient. And when we do that, we have very specific information that we give the patients, and we just don't let them walk out the door. And so it's a continued relationship. So just like for Donna, we saw Ava many times by ultrasound, following her, answering every question that she had as well as we could every time that we saw the baby.
With my experience, I would do it. If I was to get pregnant again, I would do the amnio, even though originally I thought I wouldn't, just to know if there's anything that might be wrong with the baby. I think it pays to know in advance so that you can do your research and be prepared for a child that might have something different.